I'm so nervous I'm going to get bailed out now. Okay, thank you very much. I'm Kim Winter. I'm a psychotherapist by background and I'm the CEO of Rareminds, and I'm going to tell you a little bit about what we do today. So we're a new organisation, but we've actually been working with rare diseases since 2013, and we established Rareminds as a non-profit community interest company, really to act as a vehicle to work with patient organisations and healthcare professionals to start foregrounding mental health into physical health and rare disease care. So a significant number of our team also have lived experience in rare diseases, and we think we are the first third sector organisation flying the flag for rare disease mental health, but if we're not, please let us know. Okay, so our mission is 3 pillars really: providing timely, quality, specialised mental health support services, raising awareness about the psychological and emotional impact of living with rare diseases through data, training and education, and also informing policy and practice to drive change and ensure that mental health support becomes integral to rare disease patient care. Conversations between physical and mental health care across conditions, rare or otherwise, has always been poor, and we feel that this cannot afford to be the case for rare diseases, because living with rare diseases is a challenge, as we know. So we really felt we needed to foreground this in our thinking. I'm not going to go over this in depth because I'm preaching to the converted here. You all know the challenges of living with rare diseases: lengthy diagnostic odysseys, uncertain disease pathways and treatments, and the psychological burden of being a patient expert. There's no lack of evidence of need at this point. Even in the last couple of years, we have had still assertions being made that the average therapist does not understand the mental health impact of living with a rare condition, and this needs to change. So we really felt that the first step that we needed to make as an organisation was to prioritise provision, and I'm going to start talking about that in a moment. But how we work, just very briefly, is that we work in partnership with patient advocacy organisations to allocate counsellors to work with you to grow expertise in your particular rare conditions. We work collaboratively with NHS professionals to support them in the work that they're doing. Pragmatically, although there can be excellent mental health care provision in the NHS, sometimes it can be poor and sometimes it can be underfunded. So we believe that partnerships between the NHS and the third sector is essential. We also provide support and training for community leaders, and all of this we are doing within the context of building and learning from evidence-based practice. We know that we need to benchmark the work that we're doing in able to be able to fund it with you going forward. So the first pillar of provision that we started to step in, and we thought we could wait and just keep saying there's more need, but someone needs to step in this space and start offering counselling. So in the last 18 months, we've provided over 1,500 counselling sessions to over 210 clients. Oh, let's go back one. We've also provided workshops, groups and talks. I know you're all looking at the Let's Talk About Sex one now and thinking, what is that and can we do that? Not now. And we've provided over 25 workshops and talks to over 500 participants in that time. And we also see as very important as what we do is supporting you as the supporters of your patient communities. You are a unique community in your own right. And we know how much work you do on the front line with your communities, supporting them in distress and with the difficulties that they are facing day to day. So very much part of the work we do is to be available to you as patient leaders too. Okay, very quickly, there's the right intervention at the right time we believe can be transformative. I nearly didn't share this stat. 100% of our clients would recommend our counsellors to someone else. That's a scary stat to maintain. Mental health support must be proactive and preventative as well as reactive. And this is very, very important to take forward. Early support and intervention at the point of felt need mitigates distress. optimal support is not one thing, and one size does not fit all. Just as Joe was saying earlier with young people need a range of support available to them, from individual care to group work to mentoring. The same is true for adult care. So this is a range of support we feel is very important going forward, and I'm just going to carry on gabbling. So just look at that, and we see this is about providing a safety net of support. So going forward, there is much change and much certainty in the air. We know about mental health and rare diseases generally, but we hope there are also opportunities too to really embed mental health into rare disease care going forward. Thank you for letting me gabble towards the end. Thank you.